Between August 2nd and 4th, 2014, a total of 108 new cases of Ebola virus disease as well as 45 deaths were reported from Guinea, Liberia, Nigeria, and Sierra Leone. Up to today, Ebola has claimed 4,033 lives and more than 8,000 suspected cases.
Well, the Ebola virus is a viral hemorrhagic, causes a viral hemorrhagic disease. It is now currently present in 4 West African countries where there are epidemics: Sierra Leone, Liberia, Nigeria, and Guinea. We must remember that someone can contract the Ebola virus from someone, and it can take between 2 to 21 days to actually start showing symptoms.
Symptoms are sudden onset of fever, muscle pain, and headaches, and in some cases, nausea, vomiting, and diarrhea. Although Ebola is of major concern, it cannot be spread easily.
This viral hemorrhagic disease is spread by direct contact with body fluids of an infected person. And it's quite different from chikungunya, which is a vector-borne illness, or dengue, quite different from the seasonal flu, which is a droplet or inhalation. It is not spread by water, it's not spread by air, it's not spread by food, at least in this part of the world.
Learn about the levels of risk. High risk exposure. Needle stick or mucous membrane contact with blood or body fluids from an Ebola patient, or direct skin contact with or exposure to blood or body fluids of an Ebola patient, or processing blood or body fluids from an Ebola patient without appropriate personal protective equipment or biosafety precautions, or direct contact with a dead body, including during funeral rites in an Ebola-affected area without appropriate protective equipment.
While we are being sensitive to the risk of Ebola coming to our country, we must be mindful of the fact that Ebola is not a new disease. It's been here in the world since 1976. And people all over the world now are creating panic, not based on science, but based on fear. And I hope that we could avoid that particular type of behavior occurring within the campus community.
Learn about the levels of risk. Low risk exposure. Household members of an Ebola patient and others who had brief direct contact, example shaking hands, with an Ebola patient without appropriate protective equipment, or healthcare personnel in facilities with confirmed or probable Ebola patients who have been in the care area for a prolonged period of time while not wearing recommended protective equipment. No known exposure. Residents in or travel to affected areas without high or low risk exposure.
If you have traveled in any one of these areas where the Ebola virus is endemic, Sierra Leone, Liberia, Guinea, and Nigeria, you must initiate fever surveillance for 21 days after the initial exposure. If you have a fever and have traveled from an area, then you are considered a suspected case. In that case, the government of Trinidad and Tobago has made a policy that all suspected cases must be transferred to hospital. So we are asking staff members and students who either travel to an endemic area or have come in contact with persons who have traveled coming from an endemic area to undergo what we call fever surveillance. Here at the Health Services Unit, we would ask you to come and see us once per day to check your temperature for 21 days, or we give you a thermometer and you monitor your temperature and you email it to us or text it to us on a daily basis. Up until 21 days have passed, then you're no longer at risk of contracting Ebola.
For more information on the Ebola virus disease, contact the Health Services Unit at 662-2002 extension 82149 or 82150.